Hi, and welcome to a presentation from Success in Nursing School. This is the critical thinking in nursing and is for the nursing student. My name is Ann Nolte. I am a registered nurse and a nursing instructor. Let's talk about critical thinking. You're sure going to hear a lot about it in nursing school. If we had to kind of make a definition, I would say it's to consider and analyze options based on information. But it can't be information like emotions and judgments. It has to be based on solid evidence. It's also a cyclical process, so it never ends. It just keeps going round and round and round. And it's also very methodical, so you can't skip from A to R to P to C. You have to do everything in an order for the most part. We'll get into that. So examples of some critical thinking that come to mind are, number one, scientific inquiry. You might have heard about that when you were in high school or maybe a college science class where you had to come up with a hypothesis and then you had to test your hypothesis and all those different things. Also, we heard about critical thinking when we took math classes. We have to learn what order to do different things in math so that the problem kind of works. I can remember taking a lot of tests and I had the order out and I came up with the wrong answer. You have to learn that order. Cooking is another thing that takes a task that takes critical thinking. In other words, when you make a cake, you wouldn't want to bake the cake and then mix it. You have to mix it, then you have to bake it, then you have to ice it. Well, you have to let it cool first, right? Education is another one. So when you do education, usually we do first grade, second grade, third grade, fourth grade, right? And so on. It would kind of be like someone trying to go first grade, seventh grade, third grade, fifth grade, seventh grade. You can't do that. You just get really confused. Now, I know there are some people who are really smart and they're able to skip a whole grade. Well, I wasn't one of those people. Critical thinking has to be free from bias. So you can't just say your opinion or your judgment or your beliefs. It has to be based on evidence. Each person is going to collect their own evidence, free from judgment, and they're going to make their own conclusion. So you have to have knowledge on the subject. We might ask, so what is happening in this scenario? And what action should I take? How do I do it? I know what I want to do, but how do I do it? And then I ask myself, did what I do work? And what do I do next? Because I still want to get to my conclusion. That's a real simplified way of critical thinking. Critical thinking has to be based on logic. So we have to know the weaknesses in our own thinking, or we may just kind of follow the wrong path. When we talk about critical thinking in nursing, first thing is you have to have knowledge of nursing. You have to know nursing practice. When you're a nurse, you study and you never stop learning. You never arrive as a registered nurse. You're always going to be learning. All nurses know the ethics and human rights as defined by one of our organizations, the American Nurses Association. They have books and so much information on ethics and human rights. In other words, one of them is autonomy. Patients have the right to make their own decision. It's not up to what the doctor thinks or the nurse thinks or even the family. It's really, what does the patient believe? What does the patient want to do? And that's how the nurse would help tailor the goal. So in other words, if you want to achieve a goal for the patient, you have to get to know your patient. You may have to get to know their religious beliefs, their spiritual beliefs, just how they're feeling about it, maybe even finance. Some people, they consider finance when they're in the hospital. They don't want to know if they can afford to do whatever or if the benefit's going to outweigh the cost. Nurses also have to examine their own beliefs. So I have to be, if I'm going to be free from bias, I have to know where I stand on the subject. I have to know my own feelings on it before I can acknowledge them and push them aside so that I can focus on what the patient wants. I also have to be aware of weaknesses in my own thinking. So I have to know what I know and admit what I don't know. So there may be things I don't know. I don't know all the options. So maybe we need to discover them together. Critical thinking in nursing is very cyclical. However, you're not always, sometimes you're always assessing. So when you make when you implement a plan, you're going to assess. You always assess the patient because the patient is not like a stagnant thing. Health changes, circumstances change, different things change. So you have to always be aware that your goal may change. But in general, critical thinking in nursing is very systemic. So it's a systematic way of looking and solving and thinking about problems or patient care. We have to consider the nursing process. That is the major player in critical thinking in nursing. We have 5 steps in our nursing process. The first one is assessment, then diagnosis, then outcomes and planning, then implementation, and then evaluation. A lot of nurses remember this by the acronym ADD-PI. It's a good way to remember it. So you have your assessment, diagnosis, planning, implementation, and evaluation, ADD-PI. In other terms, assessment would be like the collection of your information. Then you have to analyze that information. Then you make a plan, or you figure out your plan. Then you have to take action, right? And then you check to see, well, what happened? Did it work? And then you're going to go right back to assessment to see if it worked. Steps can overlap and they can cross over because remember I said nurses are always assessing. And this process, if it works and it goes round and round, it can go very quickly or it can go slowly. You're going to have multiple things going at the same time because you're going to have different goals for the patient. So let's just talk about each of these ADD-PIs. Assessment is the first part of your nursing process. If you see questions on your tests that are the assessment phase of the nursing process, they are going to be knowledge-based. So you're either going to know it or you're not. It's as simple as that. These concepts are usually mastered in classes like your anatomy, physiology, pathophysiology, pharmacology, and for sure, physical assessment. You have to know how to assess a patient. You're a nurse, or you're going to be a registered nurse. So we'll teach you a lot of different techniques in nursing school. You'll learn how to get a patient history, how to inspect, and that just basically means how to critically analyze what you're seeing. Auscultation, that's listening, and we usually use our stethoscope to do that. You'll learn how to percuss, and you'll learn how to palpate. Each of these plays a part in assessment. Assessment also means that we need to gather and collect some information. So we may need to know we probably do need to know how to analyze labs. What's the different labs? What images we can anticipate because we have to get the patient ready if the doctor orders it. So we have to have a little basic understanding of what each test would be as well. We also have to know how to interpret vital signs. So a blood pressure 70/40, well, yeah, they're 2 numbers, but what does that mean and what's going on with my patient? What do I need to know to avoid trouble? So we learn how to interpret the assessment that we get. Assessments can be focused or they can be complete. When I think of a focused assessment, I think of the emergency room. That's my number one thing that comes to mind, place that comes to mind. Focused assessments are the patient's complaining of this, and we only need to assess that body system. When we do a complete assessment, that's the head to toe assessment. And most nurses, at least if you work in the hospital, you're going to do an assessment on a regular interval. So if you work in med surg, you're going to do a complete assessment at least once a shift. If you work in, say, step down unit, then you're going to do an assessment usually every 4 hours. And if you work in the ICU, you're going to do a complete assessment every 2 hours and sometimes every 1 hour. If the patient's really serious, they're going to be on continuous observation. And again, the intervals that you do these complete assessments really vary on your nursing opinion, your nursing knowledge, and also facility policy and procedures. Nurses are always assessing. Every time I go into a patient's room, I'm assessing. I ask myself, what's in front of me? What's going on with the patient? How do they look? I need to paint a complete picture, and it has to be based on nursing knowledge. So assessment is like gathering the pieces of the puzzle. Now, when we do the nursing diagnosis, that's like starting to put the puzzle together. We have to have knowledge, and these are knowledge and comprehension based questions. So if you see a test question and it's in the diagnostic phase, the nursing diagnosis, it's going to be very knowledge, so you either know it or you don't, or comprehensive. Do I understand how this fits together? You have to have understanding of the information that you're going to learn in medical surgical nursing, critical care nursing, mental health, pediatrics, mother baby, and even pharmacology to make a strong nursing diagnosis. Nursing diagnosis lists, the actual list of nursing diagnoses are in NANDA. That's another nursing organization you need to become familiar with. They have a big book of all the nursing diagnoses. And there's a lot of them. But this is how we connect the dots. And we say, how's everything related? We need to analyze the information and we need to reach a conclusion to try to figure out what's happening. Based on all the information that I gathered from the assessment, what is the primary care for the patient? What's going on? We decide what information is relevant. We have to prioritize and put that information together. And it's really just collecting the pieces and starting to put the puzzle together. So if we collect the pieces of the assessment and then we analyze it, we're going to have this part of the nursing diagnosis. Outcome and planning. Well, if you see those questions, they're going to be synthesis center questions. So now we're at a higher level of thinking, we better start putting things together. This involves knowledge, and it's usually a higher level knowledge that you attain in your core level nursing classes like mental health, medical surgical, critical care, geriatrics, peds, mother baby. They also have to have knowledge of your nurse practice act. So each state has a nurse practice act, even though they're very similar. You should become familiar with your state's nurse practice act. You also have to know those ANA ethics and standards and facility policy and procedures. This is where we plan, well, what are we going to do? What's the goal? How are we going to reach this goal? We have to make clinical decisions. It's kind of starting to be time. We're putting the car in gear. We're going to say to ourselves, well, if I do this, then what happens? Will I get what I'm trying to get? I need to figure out my outcomes and how I'm going to plan to get them. So we call the physician. How do I coordinate care and how do I communicate with the different disciplines? Who do I need to call? What do I need to do? This is thinking practice. We practice this in clinical. The actions are practiced and capstone. And capstone is a class that you'll take in your last quarter of nursing school. The next phase, the fourth phase of our nursing process is implementation. This is when we put, how do they say it? The rubber to the road. So these questions are application based. How, what are we doing, and how are we going to do this? So this is where we have to have knowledge of nursing skills. We have to know how to do the things that we need to do to reach our goal or our outcome. We have to understand the equipment in the facility. We also have to know where are the items that I need. I can't go looking for them, because remember, this whole process, this nursing process, can cycle quickly or it can be slowly. Now, if it's cycling quickly, that means I need to get stuff when I need it. So that picture right there is a code card. So if you hear code blue, you better know where your code card is, because that is what's going to help you save someone's life. And usually on top, you'll have like a defibrillator and an ambu bag and different things that you'll need too. But you also have to have knowledge of pharmacology, because you have to know, should I give this medicine? Should I not give this medicine? And you have to know nursing core classes. You have to know the information from the other parts of the process in order to be able to implement. You also have to understand, and there's going to be a lot of questions on delegation. You have to understand, as the nurse, you may have multiple patients and you can't do it all. You're going to need help, but who can do what? What can our unlicensed assistive personnel do? That's your CNAs. Your CNA, they may call them BHAs if you work on behavioral health, or PCAs, that's a patient care assistant, but they're all kind of the same concept. What can they do? And that's going to be based on my Nurse Practice Act from the state. Do I have a wound care nurse? Can he or she help me? Is there respiratory therapy? Could they help me? Physical therapy, maybe? Occupational therapy? Who's part of my interdisciplinary team? And who can help me out? You also have to make clinical decisions, and you have to take the action, and you have to assess, because you have to make sure that it's the right action. It's better to know it early than later, and you're going to evaluate. Then you have to prioritize. Well, what do I do first? This is the do phase, so what am I going to do first? And then you have to document what you did. So you have to ask yourself, you're getting the orders by the provider, are they appropriate? Are they accurate? Based on what my patient's going through right this minute, are they accurate? Because remember, you're the last line of defense between the medication and the patient. So you better know what's going on there. Your last phase of the nursing process is evaluation. So evaluation questions are evaluation questions. When we talk about this phase of the nursing process, it's all based on evaluation. Do you know how to evaluate care? So we ask ourselves as nurses, well, was the goal achieved? Was the outcome met? Which means maybe that the patient's stable, acceptable level of pain, whatever our goal was, did we meet it? Or was the goal maybe only partially met? Maybe it wasn't met at all. So maybe our plan had some flaws in it. We also have to evaluate the actions and possible ways of improvement of the whole process. How well did the process work? In other words, was it smooth? Did everybody kind of work together? Or do we need to adjust the process a little bit to take care of our patients a little better? How the team worked together? Maybe that was the team on the unit. So maybe it was just you and the unlicensed assistant personnel, your PCA. How'd that work? Nursing care, did we know what we needed to know? Or maybe does the unit need to learn more things? Or maybe I, as the nurse, need to review some things because maybe I haven't done them in a while. Then you ask yourself, with the current actions, will the patient be able to maintain the outcome, or do I need to take additional actions to reach the outcome? In other words, am I one and done, or is this going to take continuous monitoring and other things? We have to ask ourselves, is there any way that we can reduce the risks to the patient, to the staff, to everybody? We're evaluating everything we did. Remember, this step takes practice, and you have to be able to put all the skills together. It's the highest level of questioning. Finally, we need to chart our results, because part of the evaluation process may mean that we have to look at history. We have to see. In other words, if we're starting a blood pressure medication on a patient, we're not going to give them necessarily one dose and say, it works, we're done. All right, we may have to give it over a period of time and see how their blood pressure is doing. So we have to look at the trends. And that's another reason charting is so important, because that's how we base our evaluation. Did it work? That's how we look at it. When we think of critical thinking in nursing, we have to understand where in the nursing process we are and where we need to go. It often involves the collection of information over a period of time, because remember, people change, things can change. They even say that when a code's going to happen, the patient will start to show signs 8 hours before the code blue starts. So if we can learn to recognize those signs and look at evaluate what we see, then maybe we can stop the code from happening. So we have to look at the information over a period of time. Nursing information often involves more than one nurse. It's multiple shifts, multiple departments. It just depends. Maybe your patient's coming from the ICU and you're on a med-surg floor, so you have to get report from that ICU nurse. Or maybe vice versa. Maybe you're on med-surg and they're going to the ICU. So you have to give report to the ICU nurse. One you have to take report, one you have to give report. So you have to be really good at giving that information and that continuation of care. You're also going to have to give report to the next shift. And you're going to have to take report from the shift before you, because it has to run smoothly. This patient care has to run smoothly. They say that you're only as good as the information that you receive. However, I say that you're responsible for all the information. You can't just say, well, I didn't know that about my patient. That doesn't fly. You have to know where to get the information and what information is relevant. So when you think about answering nursing test questions, and again, we're going to have a whole presentation on nursing test questions, but I want you to think about that you need to follow this critical thinking. You need to read the nursing question and think about it and then answer it. After you answer it, this is for practice tests, you need to look at the answer and see if you were right. And if you weren't, it's practice test, it's okay, because we learn by looking at the answers, by trying to answer it and then looking at the answers. We don't learn by taking 100 questions. We learn by looking at the rationale behind the answers. That's how you're going to learn. It's active learning. The nursing process, if we look at it, it really does fit together with all your classes. So every class is important. You can't say, well, this class is more important than this class because, well, I don't care about medical surgical nursing because I'm going to be a critical care nurse. Medical surgical is like the basis of everything. Or I don't care about mental health. Well, I tell my students, I'm like, does your patient have a brain? Then you better care about mental health. Everything fits together. Trust me, nursing instructors do not teach information. That's not important. It all fits together. So you can see the different classes and stuff that you're going to take. Assessment classes, classes that help you with the diagnosis, classes that help you with outcomes and planning. And you're going to have to also consult your Nurse Practice Acts, your state laws, your facility, wherever you do work or have clinical, or even your college, to know what you can do as the nurse and what you need to move to a higher, like escalate higher. You have to have that nursing knowledge. You're starting to put it all together. And then you have to know how to implement it. And then evaluation. And you can evaluate, and this can work as patient, the nursing process, or it can work as a community. Say you're trying to solve a problem in the community. Well, you follow the same steps. So let's look at a question and see if we can just identify the different parts of the nursing process. So you, the nurse, started vancomycin. That's an antibiotic. 750 milligrams, now it should say IV, on my patient, on your patient, 10 minutes ago. Okay, so that's an implementation, right? So upon reassessment, okay, now I'm evaluating this whole thing. Upon reassessment, you, the nurse, notice that he, the patient, has a red rash on his face and chest. That's not good. Which action should I perform first, or you perform first? Well, it's asking me, what am I going to do? So I evaluated or I assessed. I know planned outcome that when you give vancomycin too fast, the patient can have, it's kind of like it's a reaction. I was going to say an allergic reaction, but it's a bad reaction. It's called red man syndrome. That's what we learn about. Vancomycin, red man syndrome. That means that your patient's going to have a red rash on their face and their chest. So which action should I perform first? I know that I have to stop the IV. So do you see how we hopped around the nursing process, but each part has information in it? That's what I want you to do. Start breaking down these questions and look at the nursing process. When we think of critical care in nursing or critical thinking in nursing, we have to prioritize the care. So always in questions in nursing, there's 4 top nursing priorities. It's always what's going to kill them first, right? So airway, breathing, circulation. So we call that the ABCs. But now the American Heart Association said, well, maybe it's CAB, circulation, airway, breathing. Any way you remember it, it doesn't matter. Just remember, I have to make sure the heart's beating and it's beating effectively, they're breathing, and the airway's clear. The next thing is safety. We're talking about patient safety, all patient safety, staff safety, family safety. Okay, safety is the top 4. Airway, breathing, circulation, and safety. So always pick those ones first. Now there's lots of ways we can help teach ourselves to critical think. I love to teach my nursing students how to do concept mapping. Concept mapping is so organized and it's very logical, and it really helps us, just kind of expand our thinking and make sure that we're covering all angles. We're going to have a presentation on how to concept map, and trust me, it's one you don't want to miss. You also have to learn basic nursing care plans, and there's a big book on how to do a nursing care plan. Again, we'll probably have a presentation on that as well. So you have 2 kinds of nursing care plans. The informal ones are, they're just the things that the nurse thinks, standards of care that we know that we need to do. There's also a formal nursing care plan. Now there's 2 types of those. You have your standardized plan and your individualized plan. Your standardized formal nursing care plan is what we do for all patients. So in other words, if we have a patient as a nurse that's a fall risk, there's certain things we're going to do. They're always going to be part of the care plan. These things can include, or usually always include, number 1, we're going to put the bed alarm on. Because remember, safety is first. So we need to know when our patient gets up, because that patient should not get up by themselves because they're fall risk. We don't want them to fall and hurt themselves. So we want to put that bed alarm on. We also probably want to put them close to the nurse's station so it doesn't take us much time to get to them. We may also want to put 2 rails up. So it kind of just takes them a few more minutes to get out of the bed, which gives us time to get in the room. We also have to have a gait belt in the room because you always want to use a gait belt when you have a patient who's a fall risk. A lot of facilities also have non-slip socks. So they're like socks with little rubber on the bottom. Just keeps your patient from sliding across the floor. And a lot of times with fall patients or at fall risk patients, they are color-coded, so they might be yellow. If I see a patient walking down the hall that has yellow socks and they're by themselves, I know that they're fall risk and I need to get there with them. The other thing that I've seen in hospitals is sometimes we put a magnet on the door of a fall risk patient so that everybody that goes into the room knows this patient's a fall risk. These are standardized things that we do for every patient that we have used the fall score assessment and we have deemed that they're fall risk. Now there's also individualized plans that we can add. So maybe we decide for this patient they're not really safe to walk to the bathroom because they're not steady at all. Physical therapy needs to work with them a little more. So we decide that we're going to put a bedside commode very close to their bed so they don't have to walk very far. That is an individualized section of the standardized plan. So in other words, when we're going to make good or like nursing care plans, we need to learn how to do nursing care plans. And nursing care plans help us not only care for the patient, but they help us to critically think because we know we can identify our goals. And again, this is a task, nursing care plans is a task that you will learn in nursing school. And there are some really great videos on them. We'll probably have another one. So let's wrap this up. Critical thinking is the foundation of nursing. It's essential. You have to know how to critically think. You have to know and remember the basics of nursing. So pay attention in nursing school. Make sure you get enough sleep and you take care of yourself because there's going to be a lot of information that you need to remember. And you have to see how this information fits together. Again, those concept maps are great. Based on generations of hard work and advocacy. So if you look at the history of nursing, you'll see how we have constantly advocated for our patients. We're always trying to improve the process, and it's not an easy task. When we are able to critically think and use that nursing process, that's what makes nursing a profession because we have to learn what to do. It's not just guesswork. We have to understand what's going on with the patient. This also earns us a place in academia. It's really, this stuff's nice, but it's about the best care for each patient. We want to take care of our patients and we want to give them the best care possible. This all takes practice and lots of learning. Thank you for listening to the presentation on critical thinking in nursing, and I hope you come to listen to more of our presentations on nursing success.